Hey guys, this is Dr. Shivaam, and in this video we are going to study in short the ENT important questions. So these questions have been repeated already in your Neetpg examination, and as your exams are near, we will try to revise it very fast in this short video. Coming to the point, a patient came to our OPD with a swelling under earlobe as shown in the image. The swelling was non-tender and firm. So the question is identify the pathology. The examiner wants to know what is the most common cause of this type of swelling, whether it's a bezold abscess, a parotid swelling, osteoid osteoma, or a deep cervical lymph node. Now, what we want to see here is the description that the examiner gave us. The examiner is saying it's a non-tender and firm swelling. The region is, this region is your parotid region. So it can be one of your spot diagnosis that it is most probably a parotid gland swelling. Why parotid gland? Depending upon the location it has, and as they are saying, if we read the option, bezold abscess. So bezold abscess is a swelling in the sternocleidomastoid area. So basically bezoid abscess, if we see, it's a complication of mastoiditis where the pus percolates after eroding the mastoid cortex and gets collected in the sternocleidomastoid, and it will be always tender. So an abscess, if we apply our common sense, will always be tender, like here seen in the image, right? So it's in the SCM, near the SCM, and it is tender swelling, so it cannot be bezold abscess. Osteoid osteoma is a bony, benign bony tumor, and again it will be hard, right? So any bony tumor will be hard. And deep cervical lymph node enlargement. So if we see a deep cervical lymph node enlargement like here, again that enlargement is due to any infection, so it should be tender. Other thing is the location. So deep cervical lymph nodes will be level here, level 3 4, right? Level 3 2 3 4. So these level, and not in the parotid region. So here the most probable diagnosis is your parotid swelling. If we observe the peculiar feature of parotid swelling, like we can see here, it is your the ear pinna. The pinna is elevated, right? Due to parotid swelling, the pinna gets elevated, like we can see here in this figure. So here also there is elevation of the pinna due to swelling, and it is non-tender and firm. So most probably it is a benign parotid tumor or a parotid gland swelling, right? So always read the question and rule out the best option. So it could have been a deep cervical lymph node, but depending upon the location, non-tenderness, it could have been the bezold abscess, but again it is non-tender and the location will be near SCM. Why not osteoid osteoma? Because it's a bony tumor, it will be hard. So you have to find the best option among all of them. So if you do the spot diagnosis, it is parotid swelling. Coming to the next important question. A mother brought her 6-year-old child to the ENT OPD with complaints of recurrent crying and hearing loss. Here you can see a otoscopic picture of that child's ear. So again, if we see the image, we can do the spot diagnosis, but let us read the option. Whether it is bullous laryngitis, chronic otitis media with effusion, or pneumotympanum, right? So if you see the spot diagnosis is, you can see a lot more bubbles, right? You can see lot of air bubbles behind the tympanic membrane, and this indicate collection of air fluid level. That means there is collection of fluid behind your tympanic membrane, and it is most probably your otitis media with effusion, which is very common in children where there is eustachian tube blockage and collection of fluid behind TM. Now, how a bullous laryngitis will look like, and how a chronic otitis media, pneumotympanum or hemotympanum will look like. So first of all, these are the other otoscopic images you can get in case of your chronic otitis media. Here again you can see yellowish thick fluid collected behind the tympanic membrane. Again here also you can see the dull tympanic membrane where there is fluid, and if this otitis media with effusion doesn't resolve with conservative treatment, the intervention that we can do is we can insert the grommet in the anteroinferior quadrant. So here in this otoscopic image you see a grommet being placed in the anteroinferior region of the tympanic membrane, so that whatever fluid is collected behind the tympanic membrane, it can drain out through the grommet and the patient get relief. One of the option was bullous laryngitis hemorrhagica. So if you notice here the otoscopic image of bullous meningitis, you will see bullas coming from the tympanic membrane. And why these are called hemorrhagic? Because these might contain blood and patient might complain of bloody discharge on rupture of this bulla, right? So this is peculiar image of the bullous meningitis. So if you get otoscopic image like this where the tympanic membrane is showing you bulges and bullas due to bulge of the tympanic membrane, collection of blood in these bulges, it will be bullous meningitis or bullous hemorrhagic meningitis. Most common organism is your strep pneumoniae, right? So bullas are filled with blood on the surface of TM and burst with effusion of blood. So if these bullas rupture, there will be emission of bloody discharge from these bullas, right? So these are again two images of your bullous meningitis or otitis externa hemorrhagica or bullous hemorrhagic meningitis, and this is a painful condition. Severe pain, treatment is analgesic, keeping the ear dry, and incision of the bulla if needed, right? So do remember these images of otoscopic because they are now giving you spot diagnosis. Now if I want to ask you what is this, what spot diagnosis you can make out of this image. So you can see some bluish fluid collection behind the tympanic membrane. So this is a otoscopic image of hemotympanum, right? So many a time after road traffic accident or after any trauma to the ear, blood gets collected behind the tympanic membrane, and then we will see this type of bluish tympanic membrane, right? Now coming to one more option, which was pneumotympanum. So there is no such thing called pneumotympanum because normally in our ear we have air behind the tympanic membrane, right? When fluid get collected, then it is something problematic, and we called it as otitis media with effusion, right? So if there is air, that is a normal thing. So here we can rule out this option, which is pneumotympanum, right? Pneumotympanum is a wrong option just to confuse you. Chronic otitis with effusion, bullous meningitis, we have already seen. In chronic otitis media, there will be some perforation in the tympanic membrane, and then you will see discharge, right? So the here answer is otitis media with effusion. So I hope this short video have conveyed you important two questions and their description. This is Dr. Shivam. I hope it helped you, and if you want these type of videos, do like, comment, share, and tell us how I can help you more in your preparation. Till then, all the very best. You are doing very good and you will be doing awesomely well. Just keep up the work. Stay happy and stay positive.